now we're going to talk about breathing. So we've seen in the lecture, we saw the anatomy of the lungs, we saw the thoracic cavity, we saw the muscles that are at play when we inhale. And of course, when we have eupnea or quiet breathing, exhaling is completely passive. So for our inhalations, for quiet breathing, we use our diaphragm, as well as our external intercostals. And what that does is the diaphragm will pull down into the abdominal cavity, and the external intercostals will pull the ribs up and away. So that creates more space within the thoracic cavity. More space means more volume. More volume means less pressure. So when we have less pressure, atmospheric air will want to flow towards the area of less pressure. And then when we relax our muscles of breathing, our primary muscles of breathing, which would be our diaphragm and our external intercostals, the tissue recoil from the lungs pretty much pulls the thoracic cavity back to its original size. So remember that the pleural membranes on the lungs are very important for this, because it's very important both in the inspiration, that is the breathing in of air, because as the thoracic cavity gets bigger, then we have the surface tension between the visceral pleura and the parietal pleura that is formed from that serous fluid in there. So that, remember, the parietal pleural is going to be on the outside and it's going to be attached to the tissues of the thoracic cavity, and the visceral pleura will be flush with the tissues of the lungs. So as the thoracic cavity expands, that's going to pull the parietal pleura out, and the surface tension is going to hold the visceral pleura to the parietal pleura, and that's going to pull the lung tissue and open up those lungs. And so when we exhale and all this relaxes, then the primary driver of the exhalation is the elastic recoil from the lung tissue itself. We can emulate that with this model. So if we think of this jar here, like our thoracic cavity, and this little rubber thing right here, this little rubber, is very much like our diaphragm. And then the balloons inside are like our lungs. And of course, we've got these little connectors up here that would be like our trachea and our primary bronchi. So that when we pull on the rubber diaphragm here, or the rubber membrane, then it increases the volume of air within this chamber. And the chamber, remember, represents the thoracic cavity, and the rubber membrane represents the diaphragm. So as we pull it down, it creates more volume and less pressure in the chamber, so air rushes in and fills the balloon. When we release it, look what happens to the balloons. They collapse. And so this is basically how breathing works.